in my kitchen. No devices are in sight, nor is any person. The only thing I have is my list of words and my heart. Let's get started. Gloves. Move it closer. Okay, so the first word we have is the aorta. We can clearly see from the outside the large hole here. That is going to be our aorta. All right. And then we have our aortic valve. So we have this cut open into both sides. I'm gonna have to do this and flip it. So our aortic valve is going to be this little cusp right here. I don't know if you can see where I'm pointing. That little cusp right there is going to be our aortic valve, where blood flows through. And then we have our apex. That is just going to be this is sitting in your heart, kind of at an angle, chest. The apex is going to be this bottom area here. Then we have the right and left atrium. Open our heart back up. So the atrium is going to be the top chambers here. So over here we have our right atrium, and that's gonna open up just a little bit. It's a lot smaller, but it's going to be this top portion here as our right atrium. Our left atrium is a lot bigger, so we have a nice open space right over here for our left atrium. Then we have our auricles. Auricles are going to be our little ears. So again, I have it turned. This is our right side, this is our left side. Our left auricle is going to be this little ear, this little flap right here, and that will inflate and deflate. And then our right auricle, that's kind of turned to C, is going to be this bigger flap, kind of can inflate and deflate a little bit more visibly. And then we're going to have our base. That is going to be all of this upper part with all of our main arteries and whatnot going on here. Then we have our brachiocephalic artery. Not gonna lie, this one took me a minute to find. It's not hard to see, but it took me a minute to figure out which one it was. Okay, looking at the front, a part of our aortic arch, which we do not have the full thing, it's just a piece of it. It is going to be this innermost tube here. When we stick that through, open up our heart, and we can see where this comes through. Then we are going to have our chordae tendineae. That is going to be located in the both left and right chambers. If I can keep this open, I like this side better. So this is going to be our chordae tendineae, and these little stringy guys here. That's on the left, and then our right, they're a little more hidden. I'm not sure if I'm gonna be able to get you to see this, but they are these little stringy guys in here. Okay. Then we have our endocardium. The endocardium is going to be the section that encloses, or is on the inner side of our heart, and it encloses our chambers. So it's going to be this little inner layer there, along with that inner layer, that inner layer, and that inner layer. And then our epicardium is going to be the absolute opposite. It is going to encase our heart. So it's going to be this outer layer going all the way across. Then we have the inferior vena cava. Unfortunately, I was not able to locate a specific route for this in this heart. However, the inferior vena cava is going to come out the bottom of the heart When we open it up, it is going to be coming out of this right ventricle. That is where you will locate it. And then we have the interventricular septum. So that is going to be this large piece here that separates our right and left chambers. And then the interventricular sulcus, anterior and posterior. We cannot visibly see it on the inside of this heart, but imagine there is a tissue in this area. The anterior is going to be this upper, and the posterior is going to be the lower. On the outside of our heart, more upper, towards the left. On the outside of our heart, we are able to locate it a little bit more easier. It is going to come across, kind of separating our chambers on the outside. Anterior, posterior. Then we have the mitral valve or bicuspid valve. That is going to be located on the left side. It is going to be this little area here where I am sliding this through. That is going to allow blood to flow from the left atrium to the left ventricle, and this will open and close to prevent any backflow. Then we have the myocardium. That is going to be the middle part in between the endo and epi. Yes, in between the endo and epicardium. That is going to be this middle layer here. If you look closely, you can actually see the coloration change. We have the dark epicardium and then the lighter pink myocardium. Then we have the papillary muscles. So this muscle, can't specifically pinpoint it. Well, you can, but it kind of traces along a bit. It is going to connect, oh my goodness, I always space on this word, the chordae tendineae. That's what's going to kind of anchor it down. So our chordae tendineae here are going to be anchored down with the papillary muscle along that right there. Same thing on the right side. It's just a little bit harder to see, but our chordae tendineae in here, I think I just ripped one out. That is going to anchor to the edge of the papillary muscle. Then we have the pulmonary arteries. The left side was a lot easier for me to locate. So again, I'm gonna hold it towards you. Our right and our left. We are gonna go to the left side, and I'm going to flip it on the back. The arteries here, can't see it right away, but when you lift up this little piece of fat on the outside, we are able to locate one of the arteries. And we push that through. And you will see that it comes out right at the top. Ventricle. Well, I'm sorry, not ventricle. Beside the aorta, where it is going to disperse into the body. The left side, I was not able to locate a specific valve. However, I can tell you the area. Come on. We are going to, it's going to be slightly behind the superior vena cava, and it is going to go into this right side here. It's going to kind of come in either slightly to the top or sides over here. Next we have the pulmonary trunk. So that is going to, relocate our artery over here. Big old hole there. The pulmonary trunk is, and this is the outside of the cord of our artery here. So the pulmonary trunk is going to be about right here, kind of coming inward on there. Let me open it up. This is our artery split open right here. So our trunk is going to be right here. Then we have the pulmonary veins. That is going to go back. Reorientate myself. All right, back on this left side, we have already located underneath that flap our artery. Our veins are not going to be very far behind on here. They're actually showing quite well. So, got a couple of veins here. Poke it through. They come right into our atrium, left atrium. Again, I'm not able to directly locate them over here. However, they are going to come into our, did I say right atrium? I meant left atrium on this side, sorry. They're going to come into our right atrium, kind of pushing in through here. And then we have our superior vena cava. That one, flip to the back of our heart. That is going to be located right at the center, kind of going down the posterior side. And if we stick our thing down the superior vena cava, we end up coming right into the right atrium. And that is where our blood, the oxygenated blood, comes into. So that's how we know that is the correct location. Then we have our tricuspid valve. That is going to be located in the right chamber, between the ventricle and atrium. Again, it's hard to do this while holding it up, but that is going to be right in between here. That flaps are what open and closes to get blood to from the atrium to the ventricle on the right side and allow it to not backflow. So those flaps are gonna open and close. Then we have ventricles. I realized apparently I identified them while talking about them, but I never specifically pointed them out. So our ventricles are going to be this lower part of the chamber here. That is the right ventricle, and that is the left ventricle. I don't want to stop it with my nasty gloves on.